Hello. Uh, 9/6. It is 9/16. This is our health / illness update, which I think is number 31. This is the first one I've done, I think, so soon after a previous one. I got Dr. Bear and Barely Bear here with me. Barely Bear, you can't see. Okay, there you go. And so it should be a short one, I guess, because we just did one very recently on the 6th. I think we did it on the 6th because I had my blood draw on the 4th. So I'm just going to scan through for what happened. I feel like nothing happened since then. Yeah, so we went for a physical on the 16th, but it got rescheduled. I think it was misscheduled, not rescheduled. So I haven't actually rescheduled it yet. They've been really good about calling me back, but I've been too busy to think about that. I was really looking forward to it. In fact, Barely Bear was in the basket of the bike as we were biking there, and they called me while I was on my bike on my way there. Anyway, we didn't do that. I don't think it's a giant big deal. It would have been nice. It didn't happen. Yeah, and then so what's today? Tuesday. So yesterday I went to see the oncologist. I had gotten the news that my Signatera test was positive, I guess. I have this morning, I think it was this morning, it would have had to have been this morning, I got the results of the next test, which is the one I did like on September 4th or something. That was also positive and a greater number. So it's registered as mean tumor molecules per milliliter. And you can see where I was on 0, no evidence of disease, I guess 5 or 6 in a row. And then the one that preceded my most recent update, and then the one that I just got, I guess, this morning, which is 0.13 rather than 0.10. So again, I got that after I talked to any medical professionals, so I'm presuming that means that it's really hard to argue that it's a false positive, which is what I was thinking. When I saw the oncologist yesterday, she said it could still be a false positive, so that's fine. She also, so I had my PET scan somewhere in there, like recently, Saturday morning, I think. She said yesterday, which was Monday, she said the PET scan was clear, but she also said the PET scan only has a resolution of, I think she said 1 centimeter. So I said to her, well, that sounds to me like it's a pretty good bet that the ctDNA, the thing I just showed you the results for, is positive for good reason, even though we can't prove it. But wherever the cancer is, isn't growing enough yet to be seen on the imaging. She said, yeah. And I said, so I guess that means we don't have a target for treatment because we don't know where it is. She said, yeah, we don't have a target. I guess we would both expect one to show up as it meets the level of resolution for the PET scan. And then depending on where it is or whatever, that would determine treatment. She said that the ctDNA scan, which is like really cutting edge stuff, I guess even experimental, can't guide treatment. And I think that makes sense, especially in my case. We don't know what we would treat and where, and we wouldn't want to systemically treat me if we didn't know that that's a well-founded argument for a good outcome. So she said, I'd like to continue with the PET scans and the ctDNA scans more frequently. She said ctDNA scans once a month. I'm not really sure how often I've been having them. It feels like it's every 2 to 4 months. It's like a weird schedule that I don't comprehend. In fact, since I was looking at this, we could probably call up, like I had one in September. No, how does this go? We had one in December, and then March, and then June, December. Yeah, so it looks like it's every 3 months is what it's been recently. Before that, it was more odd. I guess it's become 3 months. So she said every month. She also said she'd like to do the PET scan every 2 months. And she also said there's no way, well, she said strong chances are insurance won't cover that. And insurance will say, we'll do it every 3 months, and then we'll agree, and that's kind of what we were expecting anyway. So I said, well, that makes sense. All we can do is make our best argument and be prepared for what we do when we fail it. And so she's going to make that argument. While I was in the waiting room for her, I got a message from the ctDNA company asking me to schedule my next one. That was before I got these results this morning. So I'm in the middle of scheduling that. Usually takes a week or so by the time everybody gets their act together and we pick a date. She also said to me that she'll probably just do a telemedicine call with me next time I get results, just to go over things. That makes sense to me. Okay, so what does that mean? So I guess that means I'm not going for chemo right now. I'm not going for radiation. I'm not going to surgery. But because there's 2 positives in a row, and in fact they're climbing, I don't know how much, if that's within the error or not. But I would expect that I'm not going to have to do it all right now. The bigger concern I have is that I got notices from my insurer saying, we don't know what's going to happen in the new year. It doesn't look good for you. You might have to reapply, which who knows what that means, whether it's anybody's going to accept me or even if I can afford it. So, it could all be moot and I can't get any kind of treatment at some point. I don't know. But in the meantime, I have a little bit more time to write and travel and teach. And I still got Barely Bear here with me. So next up, I'm going to meet a genetics counselor, go to the eye doctor, get my annual exam, continue on the PET scan and ctDNA. I asked her about getting a CAT scan too. She said that's on the table, but we don't need to I didn't mean like soon, but just as part of this process. And I think that's all I need to do. On the healthcare front, it looks like I'll be teaching once a month in Norwich at a physical therapy center, open to the public. So keep that in mind if you're in the area. If you want me to do a workshop for you, whether it's online or if you want to study or return to study, reach out. I'd much rather earn the money than beg for the money. Anyway, here we are. Thanks to Barely Bear and Dr. Bear. Thanks to you. Appreciate all the support and your time. Love.